Go.
Hi, my name is Ashley Warner, and I'm a nursing student at Cedarville University, and I'm going to be doing IV insertion and maintenance for my validations. So first thing I'm going to do is get my IV bag and check it against the doctor's orders and check the orders for insertion. And so I'm going to check it for expiration and integrity and make sure that it matches his orders, and get my tubing primed and ready. So I'll take off the cap, insert my thing, and hang it up. I'll fill my chamber halfway. I'll fill my chamber halfway full, and then I'll take this off without contaminating the cap, and I'll prime my tubing and make sure there's no air bubbles. And then I'd stop the flow and put the cap back on. And then I'd go into my patient's room and introduce myself and explain that the doctor's ordered for an IV to put in, and check their ID, have them tell me their name and birthday. I'd make sure that the door is closed or the curtains pulled to provide privacy, and raise the bed to a working height, and wash my hands and put my gloves on. Then I would prepare all my saline lock. Oops. Might help if I put it on the right end. And flush my tubing so that it's full of saline until it's coming out the end. And have that ready so that I can flush it when I get the IV started. And put on my tourniquet, which I won't leave on for any more than 2 minutes. I will decide where I'm going to go in, and then clean it with chlorhexidine and let it dry completely before I insert. So while I let it dry, I'm just going to tear off my tape that I'm going to use and get my needle ready. Loosen this and make sure it's ready. And they'll go and bevel up. Have this. I'm going to be placing the tegaderm on, but because of the mannequins you can't actually put it on, so I'm just going to tape my tegaderm down. So when the chlorhexidine is dry, I would insert it, bevel up, and then when I'm in, I would release my tourniquet, let it fill, apply pressure above to stop the flow, and attach my, oops, sorry, that doesn't want to attach. There we go. And then you put on your tegaderm and do your chevron tie to stabilize it. And flush it with your normal saline and lock off your saline lock, and then disconnect this and keep it down. Oh, I would have put this in sharps, but and tape this down. And then I would document the date and time, the size of the catheter, the number of attempts, and the site. And then I would make sure that the call light's in place and lower the bed to the lowest level and ask if the patient needs anything before I leave the room. And then before I leave, I would attach the solution the doctor has ordered. And then for removal, I would check the physician's orders and come in and introduce myself to the patient, explain that the doctor said we can take the IV out. I would provide privacy and explain that it's going to be less painful than inserting it. And then I'd wash my hands and put my gloves on. And then I can take the tape off of my IV and have my gauze ready. Take it off and then use gauze and apply pressure as I take it out. And then tape it down to keep it from bleeding. And then I would inspect the catheter for intactness and document the removal date and time, and make sure my patient's bed is in low position and their call light's in place, and see if they need anything before I leave. That's it.